Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2851. Today we are celebrating Universal Health Coverage Day. So, Universal Health Coverage System is the topic of the day, third webinar, and we would like to welcome Dr. Suparna Sanyal Mukherjee Madam and Dr. Sakat Kumar Basuji for their blessings. I would like to welcome Dr. C.P. Sharma sir is also with us, and Dr. Vinod Bharadwaj ji is also with us. So without wasting much time, मैं सकत जी से प्रार्थना करता हूं कि दुनिया के विभिन्न देशों में कैसी ये प्रथा है, परंपरा है, नियम है या सिस्टम है यूनिवर्सल हेल्थ कवरेज के, कृपया हमें बताएं। आदरणीय डॉक्टर सकत कुमार बसु जी। सकत बसु जी नमस्कार।
Namaskar. Thank you. Thank you, Sharma ji. Once again, it's a pleasure to be a part of this platform. Universal healthcare coverage is a very important aspect. Many countries are looking for providing health coverage and stuff, but they are not being able to provide most of the time health coverage because of improper funding, improper tax collection, and unless you take proper care and build up your resources, it is not a very easy thing to do. Now, first of all, in highly developed countries like in Europe and many other places, in Canada, the tax structure is very high and everyone has to pay taxes. This allows them to provide and work towards in providing the funding basis for which universal healthcare can be done, which means that everyone in the society who is in the job, not those who are in the students and stuff, has to pay an amount to the government that goes directly to the healthcare, and the government also puts a part of the GDP into that process, and this is being used in the universal healthcare system. What is this universal healthcare? This universal healthcare, in this sense, lies or rises in the part that anytime you feel sick, you are not feeling well, you go to the hospital. Even if you are pregnant, you go to the hospital and you have to pay as zero money. So if there is any surgery, any diagnostics test, everything that is to be covered is covered by the government in the hospitals and nursing homes down in there. You go for treatment. If you need 2 days of treatment, 3 days of treatment, 5 days of treatment, everything is being covered. One of the challenges that has come out of this system has been the towering cost of diagnostic tests, that even in country like Canada, the government has been compelled to ask the doctors that not to put so much of the diagnostic tests that it becomes impossible for the government to keep covering the high cost of various diagnostic tests. So there are say 30, 35, 40 blood tests that are individually applicable for people, and you possibly need 10, 15 tests or 20 or 25 tests for a person depending on age, gender, sex, and his health conditions and stuff. But casually doctors usually go select for screening for all say 30 or 40 blood tests that are available on the system, and then the patient goes to the hospital, they go through this, submit their blood samples, and then the results come in. But with this increasing amount of same test being done and a huge cost of these diagnostics has compelled many Western governments to think about how to handle with the healthcare, because the medical doctors, or particularly the general practitioners, which is called GP in Western countries, are the primary, uh, toll gate person that signs for the test. So unless the doctor certifies that these tests are necessary, the hospital won't do the test. But once the doctor has signed and indicated which test that this patient should continue, then he can go and get this free test free of cost. Free of cost means that at the time of his entry, he does not or she does not need to pay any money, and then results will come into the doctor's office directly, and the doctor will look into the profile and then do the proper diagnosis, and the treatments will follow. In many cases, the cost of medication is not covered by this free universal healthcare system. If you need medicine and stuff, sometimes you have to buy it outside, or you may have to have a separate insurance, private insurance, as we have it in here, like all kinds of insurance that provides the cost of medicine, surgery, and stuff. Everything is covered other than the medicine. If you have any cosmetic surgery, this is not being covered under universal healthcare because it is not an emergency health condition. It is or considered to be an ornamentation of a body and your personal choice. Third is no healthcare is properly provided for getting glasses. If you have to get glasses, you may get the doctor's treatment free of cost for the purpose. If you have serious laser surgeries and other things that you need for optometry, it is possible, but for vision related tests and stuff you have to go to the optometrist, and it is not covered under the healthcare. Fourth is the dental healthcare. Dental care under universal healthcare is not covered. It's a totally separate issue in western countries. You have to buy separate insurance for dental surgery and dental related treatments that you may need. Now, the cost of dental surgery has now increased and plummeted and crossed even high level neurosurgery cost. So, the dentists in Western countries are making so much money that they do not really know where to keep this extra money. And it has been a huge burden for the people who are unable to provide dental surgery or unable to cater to the very high needs of premium costs for good quality dental insurances and stuff and things like that. So there is universal healthcare where everyone pays as a part of the government system in which people are paying through the process of taxation. When I was a student in Canada, the system was that everyone, even every student, has to pay $44 for their treatment and stuff. But then the economy, because of the sale of oil, bloomed so much that the government took away this money. So since then, no citizens in this country has to pay any money. Whatever is detected, deducted from their taxes goes to the government, and a part of the GDP is dedicated for medical health care. The National Institute of Health, particularly in UK, also has a very great universal health care where people used to get proper diagnosis and stuff. But over the time, as the number of increase, as the population is increasing, the number of doctors in these countries have not increased to the proportion of the sudden increase in population. As a consequences, the doctors are overloaded, and sometimes it is happening in many times that people do not have a general practitioner. Now, this is very challenging in Western countries and this culture, because if you do not have an access to a general practitioner, then you cannot get any kind of prescription, and then you cannot buy drugs from the pharmacy stores, and then also unless a general practitioner certifies what kind of test you need, and unless he directs you to a specialist doctor, you are unable to reach an expert. So like if you are looking for heart surgeon, neurosurgeon, orthopedic surgeon, or any other gastroenterology and related diseases and challenges and problems where you may need long-term medication or surgery and things like that, all has to go through the general practitioner's office. Sometimes this does not happen because people are not getting enough practitioners making it available to the population. So this has been a challenge. So what is the consequence that is happening? Then people are landing up in the emergency. So if anyone appears in the emergency, it is by the constitution and the rule of the country, everyone who appears in the emergency deserves treatment. And as a consequences, the emergency system is plugging up with simple cases of cold, flu, stomach pain, headache, and other things whenever people are having problem, because they do not have a general practitioner to guide them or to get a prescription. They're signing up for the emergency part. But what is the emergency for? For really emergency diseases, like and someone has been hit by a car, or there has been an accident, someone has fallen from the building, accidental fire, or whatever. If an individual is injured or nearly close to death, or there has been a lot of blood loss, they are brought to the hospital and they go through the emergency, and immediately the treatment starts. So this has been impacted very seriously, because for this there is limit it, because people with ordinary needs are showing up in emergency and clogging up the system. So people who are in need are not getting access to the proper healthcare system in the particular for emergency. Someone may have a heart condition and other may have a cough, but both of them have appeared and knocked the door of the emergency system. So by rule, they have to respond to both person and take proper actions and decisions. But because the lack of practitioner, it is getting very very difficult for even for them to apply for insurance and stuff, because if you are not registered to a doctor in these countries, then it will be very difficult for you to file up and apply for a medical insurance. Now this is the western countries where we see it is liberal, but it is still having a strong challenges and stuff. What about India? In India, we have medical companies or insurance companies that provides us with interest, with annual, what you call it, an annual subscription that you have to pay every year, depending on what kind of insurance you have. If your age is around 40, 45 or below that, their premium is not so high. But as your age starts increasing, post 50, 55, 60, 65, 70, 75, as your age is increasing, the cost of insurance and the cost of the premium goes up. uh, i- Particularly the experience is that in western countries, once you have provided all your documents and stuff, your money is reimbursed. But in case of India, unless you have a very good agent with that particular insurance company that has provided your health insurance, the processing of the paper takes a very very long time and a clumsy way of doing it. As a consequences, sometimes patient who need general treatment or who they need admission to a particular hospital gets halted because this participating agency is not providing a clearance for the formative treatments that they need to take. So these being the challenges, one has to say that universal healthcare is indeed a boon in our society as well as a curse, because if the population is extensive and huge, then the universal healthcare profession is not that easy. Is because the money involved, amount of space and allocation in needed, and also the competition with the private insurance company. The private insurance company, once you put your claim, provides direct cost of the surgery and most direct cost of the treatments, with what you call medicine and stuff. And when you are young, you are not visiting hospital, they are very happy. But as you grow old and you have to go to the hospital for various aspects, various illness and other serious things that are impacting your health, they are not so happy, they are not processing the reimbursement so effectively. Sometimes it may happen that a person has lived for 30 years, has never used any insurance or health insurance, but he has a health card. And sometimes it could be some people have extensively used up the entire system, and now the government is asking them that they have to take a share of the expenses. um, it, it is my personal experience during my father's treatment that these times the hospitals, which are like center for creation of money and exploiting people, taking advantage of the system, is putting a lot of cost. If you do not need one Horlicks bottle a day or one pack of Horlicks every day for a person to sustain. If you take one packet of Horlicks, it will definitely sustain you for 2, 3, 4 days. I would say even for a week. But you will see that there are non-coverable bills that are being provided by these hospitals to earn money. So if they have given the patient one bottle of Horlicks, they are claiming to have given three bottles of Horlicks. Where the treatment and stuff has been only 10,000 rupees, they are claiming for 50, 60, 70,000 rupees, making the entire process of payment through their agencies difficult. And this is the reason they send in inspectors to check both the pharmacy, both the individuals who are benefiting from the system, as well as how the system is operating in various organizations, as we have mentioned and discussed. It is still a long way to go for India to develop a proper universal health care. There are so much differences between the central and various state governments that it has been impossible to establish a proper good long-term healthcare system in this respect, where it is a part of the universal healthcare. But at the same time, uh, it is the individual support or individuals doctors that have come up ahead of their time and has helped building up infrastructure in their hospitals and nursing homes that they are working, and they're trying to make it very cheap and affordable for different individuals at various economic strata to get into those treatment. Last but not the least, I am not aware if you are on Ayurvedic medication and prescription whether there is any insurance coverage for this. By Ayush, I also mean homeopathic treatment, Ayush based, our Ayurveda, Siddha, Unani. That Professor Sharma may enlighten us that if any insurance company provides any coverage if you take Ayurvedic medication and stuff, and if it is way more expensive or affordable, people need to know, and this will help them a lot. So, with this, I conclude my presentation. So, universal healthcare is good in one sense, but the implementation with the increasing number of subscribers across the country, across even Western countries, is showing challenges. And for a country like India with 1.4 billion plus population, it's a huge task. But if the government is able to afford this to the significant, at least to 50% of the citizens at this particular point of time, then India would should be given a Nobel Prize in Peace for reaching out to a large number of people and communities for their great services, because we healthcare is something that needs great support, and the government also has to monitor and keep a surveillance on the hospitals as well as prescribe doctors in making sure that not always super expensive medications are being prescribed. You are not being held in the hospitals for too long just to make the bills stronger, or you should not be given medications for which you have no ailments, or you are just holding back. You could have been discharged 3 days before, but if the hospitals are holding you back because they think they can make money from you when you should have been discharged and resting at home. So things like these, the corruption, the nepotism, and the challenges of implementation at the ground level with respect to universal healthcare system in India is still a long way to go, and it will help India to establish itself as a developed nation because it provides benefit to such a huge population. I feel that the government is working towards it with some loopholes, and we need to work together to identify those challenges and fill in the gaps through these processes. There needs to be way more monitoring and surveillance by the government and the insurance agents to make sure that people are not abusing the system. Particularly, even if you are not sick, you are going to the hospital taking advantage. Even when you do not need too many tests, you are asking the doctors to put in too many tests. These kind of activities put stress on the system and breaks down the appeal of the universal healthcare system. I am going for a treatment because few other people have also provided money in addition to me. It's not just my own money. It's the whole national money that comes from every corner of the society. We should be respectful not to misuse it or abuse it, but at the same time we should be using it so that general healthcare systems over the country gets better over the time. For particularly for higher income, middle income, and upper lower income group, they are able to afford this and should look into opportunities for availing medical insurance and other protection for helping them in spite of the challenges that they face as additional medical support in addition to what the government provides you at any case for any citizen. With this, I conclude my presentation, Professor Sharma. Thank you very much for inviting me on this very sensitive and important topic that we are having a discussion tonight because it affects everyone, not just Ayush Samriddhi. Every single person who uses phone is angry about the government's indication that the phone maintenance cost or everything will go up. But similarly, is this if more and more countries, more and more people are keen and join together in this particular arena, things would get better. But if you are isolated, then no one is going to listen you, and the cost of medical treatment will go higher up. Thank you very much, Dr. Sharma.
Thank you, Shekhar. Thank you very much for your nice words. Before calling Dr. Suparna Madam, I would like to share my sentiments as you told about universal health coverage in India. So, 10 minutes I need with your blessings.
Please go ahead. Thank you.
Universal health coverage means that all people and communities can use the promotive, preventive, curative rehabilitative and palliative health services. Right from the birth to death, every service is covered, that is universal health coverage. So all people assess the concept. Universal health coverage as a concept was born in 1883. In our Ayurveda, universal health coverage was included right from the Vedic sciences. In Veda, generally, who can afford the services, they were going for universal health care, maybe Darbari, maybe Raja, not normal people, but they were that there was there. So later in this was introduced by Germany, health coverage or achieving health status of its young population. Later in 2005, World Health Assembly adopted the term USC. In 2005, World Health Assembly adopted universal health coverage term, and in 2010, World Health Report focused on health systems financing for countries to build a platform for USC. So means World Bank is also supporting to create the infrastructure for USC. Need of USC is there, but in India, as we know, against the recommended 85 doctors and 255 nurses and ANMs per lakh population, there is only 45 doctors and 75 nurses and ANMs. So see the difference, hell and heaven difference in need it is observed. Quality of healthcare services we know, so there is nothing to discuss. Affordability. Now I am thankful to respected Pradhan Mantri, our Modi ji, for Ayushman scheme. Maybe in our West Bengal Swasthya Sathi scheme or Ayushman scheme, but these are important steps for universal health coverage. And recently, our PM has announced that everything will be free for medical treatment beyond age of 70 age plus. So definitely it is the means and step for universal health coverage in India. Definitely. Health for all, Millennium Development Goal and sustainable development, people, services, products, finance, policies, and information. These universal means for everyone. This is universal health coverage, right from people, services, product, finances, policies, and information to the patient. So, equity in access to health services, this is the first definition and objective. Equity in access to all health services for all. Dimension of USC. The USC cube, just see, three dimension of USC. Number one, population coverage and equity. Number two, service coverage. And number three, financial risk protection. All three important factors are covered in these three dimensions of USC cube. What guided the formulation of USC in India? Principle guided the formulation of USC in India is universality, equity, non-exclusion, and non-discrimination. This is in Ayushman or Swasthya, whatever we can say. Some states have changed the name of government schemes, central government schemes. So anything can be done. And our India is also ahead on the universal health coverage. Sorry. Financial protection, comprehensive care in good quality, protection of patient's right and guarantee appropriateness of care, patient choice, portability, and continuity of care. This is on the patient desire, not forcefully, as Sakarji was telling, but what Sakarji was telling, it is in the practice. What should be there, it is in the paper. Consolidated and strengthened public health provisioning, Accountability should be identified. Transparency of system will be there. Community participation, putting health in people's hand. This is the aim of that. So evaluation of USC in India. It started in 1946 as per the Lord Macaulay system. Bhor committee was there. Then Mudaliar committee, Jangalwala committee, Kartar committee, Srivastava committee. So many committees health were there. And then National Health Policy was drafted after 2015. So high-level expert group report constituted in 2010 and report given by this group in 2011. Recommendation of high-level expert group in USC, 1.2% is the current expenditure on health. It should be 2.5% at the end of 2022 and at least 3% of GDP by 2022. But it is not there till now. It should be there. Human resources should be increased. Access to medicine, vaccine, and technology should be there to patients, and health services norms should be reviewed. Management of institutional reforms are in progress. Community participation and citizen engagement are being increased through Anganwadi workers, Asha workers, camps in the villages, rural villages. So many activities are there at present by the government and by colleges, medical colleges, Ayurvedic colleges, dental colleges. Every college is contributing to healthcare of the nation. Monitoring and evaluation system should be developed. So USC focus areas are human resource requirement, access to healthcare service, management reform, community participation should be there, access to medicine, healthcare financing, social determinants of health, urban health, female gender, public-private partnerships, and information technology enabled health services. Thanks, Corona, you have done this, and now all these things are being taken care after Corona. So schemes to promote USC, National Health Mission, Janani Suraksha Yojana, the Rashtriya Swasthya Bima Yojana, the Jan Aushadhi Program, so Health for All Ayushman Bharat Yojana by Pradhan Mantri ji and launched in 2018. So many first pillar protection, health protection, second pillar health and wellness center. So in first pillar, we are reaching out to approximately 40% of country's population, roughly covering 500 million individuals through Ayushman Bharat. Second pillar, health and wellness center. About 150,000 health and wellness centers would bring healthcare closer to the people. These are started and now it will reach to the limit. So many services will be there, right from pregnancy to geriatric care. To reach the maximum number of people, continuum of service, constant innovations and routing, monitoring and interventions. The vision, USC by 2020, it was the vision. Now 2020 was gone in Corona, and now we are going ahead by 2026. Janch, health technology infrastructure for universal healthcare, one Janch. It uses information to empower individual to improve the health of the population. Janch, one software is there, my portal, my health, my appointment. So Janch is the portal, physician and hospital portal, national portal. Outcome of USC, what is expected? Greater quality, improved health outcomes, efficient, accountable and transparent health system, reduction poverty, greater productivity, increased jobs, financial protection. This is the expected outcome from USC. USC will be achieving an acceptable standard of good health for people of India. This is vision of USC. Now, with kind regards, I would like to request Dr. Suparna Sanyal Mukherjee Madam for her valuable blessings on the topic.
Thank you. Thank you very much. Very good evening to the all dignitaries over here. It's a very good initiative of the AYUSH Samriddhi Universal Health Coverage. Universal Health Coverage, which is known as Universal Health Coverage or Universal Health Care. So, universal healthcare, we can say it is a single phenomena. It is a multiple phenomena. This multiple phenomena, especially the depends from various countries. The one country is quality and healthcare system is different from the another country, but the medicines which has been prepared for the betterment of the human health, that is to some extent is same. So, but it is also depending upon the geographical region, which is very important for the patient, those who are taking care of, and those who are application of the medicine is very challenging. In this situation, we can say that it is generally organized around providing the either all residents or only those who can't afford on their own with the either health services or means to acquire them with the end of the goal improving the health outcomes. So outcome process is also very important for this medicinal aspect. Some universal healthcare system are also government funded, and there are so many the healthcare system which is the based on a requirement that all citizens purchase private medicines, private healthcare assurance, private organization, the medicine shops, the pharmacies, the universal healthcare also determined by the three critical dimensions which is covered, what services are covered and how much to the cost is covered, and it is described by the World Health Organization. Whatever medicines you are applying to the patients, it is also the covered, and also the hashtag by the World Health Organization, which is a situation where citizens can access health services, and especially these services without incurring the financial hardship. So the WHO also provide the universal health coverage as a single most powerful concept, and which is the public health, which has been emphasized and which has been offered since the unifies the services and delivers them in a comprehensive and integrated way. Just because of the one goals with the universal healthcare is to create a system to protection which provides equality to of opportunity for the people to enjoy the highest possible level of health. And critics say that universal healthcare leads to longer wait times and worse quality healthcare. So this is a part of sustainable development goal, and this sustainable development goal has been fostered by the United Nations, and the members of the United Nations was agreed, and they stood for the to reach to the universal development goal, the sustainable development goal, that is 7. And this coverage, the worldwide universal health coverage by 2030 should be incorporated, and therefore the inclusion of the universal health coverage, that is UHC, within the SDGs target can be related to the people at large, for the reiterated endorsements who has been operated by the WHO. So we have seen in the various countries universal healthcare system is different from one another. So in that aspects, we have to depending upon the universe. Like the insurance coverage of while our former speakers also mentioned, Professor Sharma, Dr. Basu also mentioned that the universal health coverage is a very crucial part right at this moment, just because of the government of India provide universal health cover, government of America, government of UK, the other parts, so they are also providing the universal health care system and the coverage, but which is not matched with the others. Just because my insurance cannot be applicable to the American insurance cannot be applicable over here. But if we can have, or if we can take the any medical support, so that coverage will be will get it in the Indian currency and the American currency. So this is the system where this insurance for their low wage workers, that is those who are the marginalized people, the low wage people, they should also cover this insurance. They should come to this insurance, just because of the each and every individual are the very good, and not only very good, they are our you know asset. Every individual has its own benefit, because they are the our fellow citizens, and they are the basic need of us, because everyone is precious to us for the nation building. So the way we are covering this healthcare system, and the way we are also providing the medicines, and it is very important. And with the support of this the healthcare system, there should be Ayush healthcare process should be started, because which is very important, that we are just leaving the Ayush very freely. We are just giving so many tax to the Ayush, but it is very negligible way. But we are providing the healthcare coverage with this the allopathic healthcare coverage, any kinds of operations, any kinds of X-ray, then the ECG, the other tests. So we are doing by this health coverage, but there is should be hashtag for the Ayush too, where the people should get the any kind of health coverage from Ayush or homeopathic, whatever may be. So it is also observed that the 2023% report has been submitted to the WHO cases, and especially the adolescent towards the universal health coverage by the year 2030, and they have the process has been started. So it is also a very important part for the country, that is the health workforce and infrastructure should be developed, and this infrastructure also provide the good benefit of the healthcare system. And there should be a government policies which has been helped us for the betterment of our life and betterment of the health provisions. So here the Shastro Shati, and then the Ayushman Bharat, so many healthcare systems are there. The senior citizen also are getting the privileges, but at the same time, those who are government employed, they are getting the better privilege rather than the others. So this is very important part for the healthcare system. And Ayush, though there is so many medicinal plants, the restoration of the medicinal plants for for giving and preparing the medicines also should be covered through this healthcare system, especially in case of the Ayush. So then we can develop our healthcare system, and we can cover the people throughout the world, because Ayush is applicable everywhere in the every parts of the world, and that is the universal process should be started through Ayush. And it is a very important and very incredible for the Indian subcontinent and the Indian people, those who can foster and who can depending upon this healthcare process. So we are also uh, converse, we are discussing, we are attending webinar, seminar, whatever, but it should be applicable in the practical life. Not only the theory based approaches is suffice for this the present situation. The practical situation should be incorporated, and if we can incorporate it, then we can explode it and we can achieve it. What we should achieve? We should achieve the universal health coverage throughout the world, and we can bring the all the people in the one umbrella. So if it is a one future, one earth, one universe, then the universal healthcare should come to this one family system, that is the under the one roof or the same roof. This only possible by this Ayush, because Ayush has to explore, and it is a very important part of the Ayush, because Ayush can explore throughout the world, because Ayush medicine is more or less the same in each and every part of the world. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
थैंक यू वेरी मच मैडम, थैंक यू वेरी मच। बहुत अच्छा बोले आप लोग, बहुत ही अच्छा बोले। यूनिवर्सल हेल्थ कवरेज वाकई में काश हमारी इंडिया में सभी को सुलभ हो, यही हमारी प्रार्थना है गवर्नमेंट से। मैं डॉक्टर सीपी शर्मा जी से कंक्लूडिंग रिमार्क्स की वो तो गए। थैंक यू वेरी मच। गुड नाइट टू ऑल मैडम।